Awesome. I think we're live, Sarah.
Yes, we are indeed.
Fantastic. It looks like we've got quite a few people on the session with us today. So I might just kick off. Thank you to everyone that's joined our session today. My name is Marlon, and I am the product manager of integrations at Telstra Health, and I will be your host for today's talk. So if we go to the next slide, please, Zach. Before I start, I would like to pay my respects to elders past, present, and emerging, and extend that respect to all Aboriginal and Torres Strait Islander peoples. Telstra Health acknowledges the traditional custodians of country throughout Australia and recognises their continuing connection to land, waters, and culture. So if we go to the next slide, please, Zach. Um, Again, my name is Marlon Tran from the Telstra Health team. I am joined by Sarah Thiessen today, who is the Nursing Clinical Director at Intelitech Health. Sarah, did you want to make a quick introduction to yourself?
Yes, thank you, Marlon. So my background is in nursing in various positions through obstetrics, emergency department, public health, and now in technology for the last decade, delivering solutions to help support our general practice teams. So really appreciate being invited here today.
No, glad to have you here, Sarah. We are also joined by Dr. Julian Fidge. He will be joining the session in a moment's time, but we'll have him joining shortly. So before that, Sarah, let's talk a bit about Intelitech Health. For those who aren't aware of who Intelitech Health are, could you tell me and tell the audience a bit about Intelitech Health?
Yeah, absolutely. And also just the relationship with Dr. Fidge. So Dr. Fidge actually joins us from a rural general practice. So we know there's lots of, unique challenges that come with rural general practice. And Dr. Fidge has also over 30 years experience in the technical and clinical, kind of that love of both technical and clinical aspects and solutions. So with Dr. Fidge, he and South Wangaratta practice, they've were part of our beta clinic. So he's been using the service now for over 6 months with our release, so he'll be able to give insight. But with the Intellitech Health, we come as a global company, but based here out of Australia. The clinical virtual assistant, which is our AI medical scribe, which we'll be going through today, has been integrated with MedicalDirector over the last 6 months. But this technology was actually built and robustly built since 2006. So we will talk about some use cases of other areas that we support globally with the AI Medical Scribe. Again, it's just very easy to use, launches within your secure medical director environment. Key notes is that the AI engine that powers that virtual transcriptionist is all here locally. So it's like having a person in Sydney. There's additional support to your team. And then once all of the documentation is done by your clinical virtual assistant or that AI scribe, everything is deleted. So once it's approved and inserted into your secure medical director environment, everything is wiped from the system. So there's no storage of patient data and also no use of that transcription for training purposes.
Fantastic, fantastic. Yeah, personally working in the partner integration space, Sarah, one of the first, non-negotiable things that crosses our minds are privacy and security. So when we assess partnerships, we're always considering where the data is stored, how and if the models are trained, and how patient consent is obtained. So glad to hear that Intelitech Health has that all covered off. Now, Sarah, I know we're diving into it, but I'd love to hear for those, some people on this call, it might be their first foray into AI. Could
Mhm.
you share with our listeners how the technology behind AI scribing works?
Yes. So if you want to just click to the next slide there for a sec. Thanks so much. So we've got use cases in with AI. So we'll just click to the next screen, and I'll come back to some of these in our future focus around billing, that auditing support, and then also around the inbox and document management. So some of the use cases that we see globally and support globally is around appointment booking. So with AI, it's having that localized machine that's helping assisting our teams. And with this solution, what the AI does is it can take that real-time voice and also text messaging interface between patients and booking in with their EMR scheduler. It can book across multiple services, such as we work within hospitals in Europe to book that MRI specialist, lab service, help direct the patient to those services, but then also booking those facilities and human resources to power those services. So with this service, we save, a minimum of 30 minutes per day for clinicians, hundreds of hours on the administration side, and just for patients, they get that instant confirmation and direction. Today, we'll be honing in on the clinical virtual assistant, which is the AI Medical Scribe. So you can think of your AI scribe as a virtual transcriptionist. So it's almost like having a human real person in Sydney sitting in an office, except that person is within a secure cloud environment. So we use the Azure cloud environment to protect and encrypt kind of all of that, the transcription data that's coming in. What the scribe will do is it takes a real-time voice to text. So there's no recording that's being sent. It's almost basically, Marlon, like taking a piece of paper, you're jotting down notes. That piece of paper gets securely mailed to that virtual assistant in Sydney. She opens up the piece of paper, has all that context around the consultation, and she's able to pull out of what you want to generate out of the consult and that context, such as SOAP notes. So you've got your subjective, objective, assessment, and plan data. Can also generate other documents such as medical certificates, referral letters. The sky's the limit, really. And we'll see from Dr. Julian how he uses what we call the template writer to generate, very customized templates. So, and then once all of that documentation is done and approved by the clinician in MD, basically that transcriptionist takes that piece of paper and all the documents, puts it through the shredder, and it's incinerated. So there's nothing that is stored after. So again, just adhering to the, that kind of highest data privacy and security for patient data.
Awesome, Sarah. That is incredible. It always baffles my mind how quickly AI is advancing in our everyday lives. So, you've talked a bit about it. Can we see it in action, please, Sarah?
Yes, absolutely. Perfect. So everyone is very familiar. We launch within MedicalDirector Clinical. On your smart bar, you will find in your icons this very lovely little pen icon. You click the pen icon to launch your smart scribe. With IntelliTech Health, you can do a quick dictate. So if you like to generally, dictate those consult notes post-consult or referral letters, you can go through the quick dictate and just simply start recording. And anything that you want to dictate into that field within MedicalDirector Clinical, you can go ahead and just freely dictate that text. And as you can see, the clinical virtual assistant is following along. Once I finish my dictation, I can copy that dictation and again paste within the health record. But what we'll focus on today is around start consultation. So this is where your virtual transcriptionist sits. And for just ease, I will copy in just a transcript from urgent care this morning that I did. So when the patient comes in to the consultation room, we can just easily click start recording. And again, the Smart Scribe will start recording. It will take away any extraneous data. So if I'm assessing a baby starts crying, or we're talking about the next footy game, all of that kind of erroneous data gets deleted out of the output. I'll stop recording. And once we have finished that consultation, I can go ahead and click Generate Note. I can also choose between templates. So for this demonstration, I'll do the SOAP Note Lite, but I'll come back and show a discharge template and also issues list. So what's happening right now is that kind of secure letter being sent to my virtual receptionist, and she's processing the consultation into the outputted note, being that subjective, objective, assessment, and plan. And as you can see here, it's quite fast that it's able to get back and forth into your secure environment. Here I can go back and now generate a discharge template if I wanted to. If I had, so this is for, again, urgent care, or if we do any specialist services, mental health, and diabetes training. So if there is, again, for different various roles within the practice and specialties, they can all have customized templates. So we will go through to showing the issues list. And all I simply do is once I review the output, I can make any additions that if there was additional assessments that maybe I didn't want the patient to necessarily hear while in the consultation room, I can add in those additional points and assessments. And if I'm happy with the note, I can approve and click more, or I can approve and return to the beginning if I have another consultation. But what we'll show is the additional functionality. So based on that transcription, I can also generate further documents such as referral letters, medical certificates, and discharge summaries, which you've seen previously. So we'll go ahead and generate that referral letter. With the referral letter here, I can again approve. I can copy and paste within my letter writer, and that will go into my letters. So here I can select the, the doctor, and here in my letters is the output of the referral letter. We are continuing to expand on our integration with MedicalDirector for that template writer integration and deeper field integration. So things like vital signs, smoking status, demographics can all get picked up from the transcription and once approved, inserted into the relevant patient fields. So it just really helps, again, with that longitudinal documentation, as well as for auditing purposes as well too. We've got now kind of that thorough records that your admin team, your nursing team don't have to go back and then start updating smoking status, alcohol status. We can pull that right from the transcription.
That is awesome, Sarah. I'm excited to get that deeper integration work going. But that is incredible. Now, I think you mentioned in during your demo integrated and then unintegrated. Would you be able to share with the viewers, Sarah, what the difference is between the two and why integrated options and solutions are more valuable?
Yes, absolutely. So within Teletech Health, one of our kind of cornerstone, um, you know, value into and what we want to deliver into the market is always an integrated solution. We know from data coming globally, specifically, there's been a lot of research done on the importance of non-integrated versus non-integrated AI solutions.
Dr. Fitch, you are,
Can you hear me okay?
yes, we can hear you
Yes.
loud and clear.
Okay, thanks for the question. Well, I guess the the reassurance I get from the integrated solution is that I can get support if I need it. So if something goes wrong, then I can ring up and get technical advice on how to fix that. So I can rely more on the integrated solution than one of the other third-party solutions. And the other thing that I take comfort from in the integrated solution is that I understand that it complies with the Australian privacy requirements, that we need to keep these things, patient information, secure onshore. And my understanding is that there's actually no recording made of the transcription.
That's correct. And Dr. Fidge, I knew you work in a very busy rural practice. Does your clinical practice look or feel different after using your integrated scribe?
Yeah, so the thing that general practitioners generally, not just in the country, but generally get chipped about, and doctors more generally actually, get chipped about are the quality of our notes. And that's because we're always juggling focusing on the patient, engaging with the patient, building that therapeutic alliance, and then trying to satisfy all the regulatory and medico-legal requirements of keeping good quality notes. So the 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 thing that looks different now, and I've had the practice manager and the nurses comment on this, is that there is much more detail in the notes, and the and the notes, depending on the template you're using, are organised in a way that everybody can expect, can be familiar with and know where to find the information that they want. So there's been good feedback about the quality and the organisation of the AI transcript from MedicalDirector.
That's wonderful. And is there anything that particularly concerns you with the use of non-integrated AI scribes out there?
So the the thing that concerns me is the privacy of patient information. So I'm not I'm not able to satisfy myself that the use of a third-party transcription service complies with the Australian privacy requirements, and I don't know where the transcription is actually done. I don't know if there is a recording. I assume that there is a recording made. I don't know how long it's kept, and I don't know where it is kept. So I can't really, in good faith, have any confidence in patient confidentiality with the third-party programs.
Absolutely. Good points, Julian. I did want to ask you, Dr. Julian, what advice could you share with fellow GPs who might be on the call, who may be on the fence or have some reservations about adopting AI? Is there anything that you could share with them?
Oh, well, I'd encourage doctors to try the AI transcription services. I've given you the reasons why I think that the medical director one is the one that we should probably be using, or everything else being equal. And I think that there's multiple points which I'd like to touch on. I think that it gives you more and better quality notes, and I think that it saves you time because it automates the process, and if there is editing needed, it's not much that is required. It allows me to focus on my patients, and it also allows the patients to focus on me because I'm not taking my focus off them to type in the notes. I don't have any problem typing notes, but it is a distraction for the patients, I think, sometimes. I think that the other thing is compliance. So it improves my ability to prove that I'm complying with the NBS requirements, with the item numbers that I bill, and it provides a better record of my consultations for medico-legal purposes, if that ever arises. And the other thing that I have created a template for and that I use the AI transcription service for is recording case conferences and teaching. If there is a patient review, I have a template that I use to record my teaching or the case conference with the registrars, and I've found that very helpful, and it frees me up to really concentrate on the registrar. And I think it enhances the whether it's teaching or a consultation with a patient. I think it enhances it because it allows you to make more and better eye contact, and to really let the patient or the registrar know that you're focused on them.
That's wonderful. And just to add to the templates, as Dr. Fidge was mentioning, just some customizability that I will just quickly show what that looks like for those attending. In Medical Director Clinical, when you launch your templates here, we can click More Templates, and you can choose out of a list of all of your customized templates, but you can also add and manage templates. So this sends you to the template writer. And here in your template writer, I'm going to launch another page. I'll just go back to we can add a template and create a template. And you can create a template by copying, pasting an existing note from a file or from a text prompt. So if I want to create a nurse triage template, I can just send in via prompt. What I will do is just create one from a previous template. I can just easily copy that template, or if it was a previous note, insert into the template writer, and again, click generate. The AI will be examining all of the headers, and if we had specific fields here from a previous note, it will be examining the content to match the content into those relevant fields. As you can see here, it has listed what we would like to see in each of the fields in our template. We can add, we can also tell the AI that actually for the diagnosis, I want this in bullet point. And for history, I want it more verbose. So we can get very customized to the uniqueness of, as Doctor had mentioned, the role and also the output as well too. So we can go ahead and save that template. So this is going to be my discharge summary. Oops. And we can go ahead and save.
So I think we've seen how it works, what it looks like in action. I suppose might go to the next question, which is how do I actually get to use Smart Scribe? So Zach, if you could flick over to those screens, if you would like to use Intelitech Health, it is available today through Medical Director's Smart Bar as a widget. And for those who aren't aware, the Smart Bar contains various widgets that help enhance GP workflows and provide additional capabilities. Every single widget that we include in our Smart Bar is rigorously tested and approved before being made available to Medical Director customers. Dr. Julian did talk about the importance of those privacy requirements. Again, we make sure that all of our partners adhere to those requirements. Now, the Smart Bar acts like an extra window that is pinned to the right side of Medical Director Clinical. If you can see the Smart Bar in Medical Director today already, great. Look out for the Smart Scribe widget. And if you click that Smart Scribe widget under there, you can select Intelitech Health as your partner for AI scribing. If you can't see the Smart Bar or you're enabling it for the first time, you'll just need to log on to Clinical, click the Options button, and then there's a tab in there called Clinical. Click the checkbox that says Show Sidebar, and then it will appear on the right side of your screen. If you click to the next slide, Zach, this is what the Smart Bar would look like. Click on to Intelitech Health as your scribe provider, and you will be able to get started right away with a free trial. So, Sarah, I did want to ask you, what is next for the team at Intelitech Health?
Yes. So with the integrated Smart Scribe, how we have designed it that within 2 minutes, so your practice manager can sign up or GP owner. We just do a verification, just one single sign-on via email. So it takes less than 2 minutes, and you can enable your entire practice within. So each individual user doesn't have to create a login and log in every time. So that's been one, kind of breath of fresh air for our clinical teams, is that everybody in the team can get enabled and have a try for 30 days. What we're building on and releasing very soon, it's in QA, is around the MBS billing prompts. So as Dr. Julian had mentioned, we've got, just that thoroughness around the accuracy of the notes, but then we can also take from that transcription data and supply billing prompts. And we are working with the MD team around integrating that into PracSoft. So looking at the in future release where you can go ahead and approve the billing codes, and right away it generates that invoice in PracSoft. The other area is around the in that secure insertion into the patient field, so that we get, again, that well-rounded, very thorough patient record with, again, very minimal effort from our clinicians having to, copy and paste into specific fields.
Perfect. Perfect. I did see a question pop up that did ask about whether or not there was going to be support to recommend MBS item numbers based on the transcript. So glad to hear that that is coming. Now, before we head into Q&A, Dr. Julian, I might be asking you to look into a crystal ball here, but I'd love to hear from you, a trailblazer, someone that's been looking into digital solutions since the 90s. How and where do you think AI could be applied to next in healthcare?
Also, diagnosis and management. So the so we've had rules-based systems since the 80s. There was one called Myson, which operated as a specialist hematologist, and it did very well. But if you have a simple presentation, then then a rules-based system should be able to offer a diagnosis and some differential diagnoses for you to consider. And then the next thing after that is if you decide on a diagnosis on taking you to the relevant guidelines and management tools for that diagnosis.
Might be some low-hanging fruit for you there and the team to work at, Sarah. Thank you, Dr. Julian.
Welcome.
I might dive into a couple of the questions. Sarah, I've got a question here. How accurate is the voice recognition, and does one have to train it? Do you have to use a specific microphone?
No, you can use just like a simple webcam. However, there are options on the market that we can provide as recommendations. It's on the website and it'll be in this content. Just for like a kind of a plug and play mic that doesn't require any drivers. They're less than $100 and it can sit inconspicuously behind the computer. But what it does is it has 360 pickup. So if you're doing, assessment at the far side of the room, the microphone is still able to gather at, because again, the scribe works on that voice dictation. So it's very accurate in what it can pick up, even from a basic microphone such as your phone. But today, kind of why we do what we do and around kind of the questions around accents and pickup. I just received an email from one of our clinicians who had written in, today, after just one long day of work with the software, I can only say 2 words. I'm amazed and blown away. I tried the SOAP and problems list templates. Note generation was awesome. Accurateness of voice recognition is 99.99%. I will be reporting more details once I regain my breath, possibly at the end of this week. So just, I guess, from the from clinicians, boots on the ground, just how accurate it does pick up. And I'll let Dr. Fidge as well comment on.
Thank you. I have been very impressed by the improvements in voice recognition recently, and also the ability of the software to deal with different accents. It does that really well, and I am also amazed at how well the voice recognition, at how good the voice recognition is.
Incredible, incredible. Thank you, Dr. Julian. Sarah, a slightly bit more technical question here, but for transcribing using IntelliTech Health in MedicalDirector Clinical, does it require a constant internet connection? And what happens if the internet drops out?
Yes, so one of the requirements is a secure internet connection, just because the scribe is taking real-time voice to text. So because there is no recording that is being taken, it does require a stable internet connection.
That makes
But
sense.
if that
Yep.
does drop out, what you can do is post-consult, you can dictate into the clinical virtual assistant, so into the AI scribe. So you can just dictate your notes, what we have seen for findings, and again, click generate. And once we've got that secure connection, that transcript is then encrypted to the AI engine, back to Medical Director to be reviewed, approved, and then deleted.
Perfect, perfect. We have one last question from Stephen, and I might answer this myself, but Stephen asks, is this feature pre-built into MedicalDirector Clinical, or do you require a third party? So because this is an integrated solution, it is pre-built directly into MedicalDirector Clinical via the smart bar. So if you access the smart bar, and if it isn't there, you simply need to add the smart scribe widget into the smart bar, and then it will be available. So no need to download anything else or hop between different screens. So I think we're just about at time. Thank you to all who have tuned in to our session today. This is a recorded session, so if you'd like to play this back, we will have a recording link available. And lastly, if you'd like to reach out to any of us, we will be sending out a follow-up email after this event, and we can answer some of the unanswered questions there as well. Thank you for joining, and have a wonderful rest of your day. Thanks, everyone.
Thank you.